here in Maine, which has a federally facilitated insurance marketplace, just as every other state that has a marketplace that's being run by the feds, it's under 19. So anybody who, as of the first day of their plan, the first effective day of their plan, if they have not yet reached 19 years old, they will have the pediatric dental benefit. It doesn't matter. So, for example, let's say it doesn't matter if they turn 19 during the year. If you think of the example of a plan year that starts from, say, January 1 to December 31st, if they are not yet 19 on January 1st, throughout the duration of the plan, whether it's a contract year or a calendar year or a plan year, they will retain the pediatric dental benefit for that entire plan year. And then only upon renewing their plan or terminating and getting another plan would they then switch over to the adult benefit instead of the pediatric. Okay, and that is not a Delta dental rule. That is the federal regulation. So that's how all of the dental plans should be working going forward. Those that are being offered that satisfy the pediatric dental benefit. So here are some of the plan plan requirements. And again, this is not a Delta dental rule. This is for anybody who's offering the pediatric dental benefit in a federally facilitated marketplace, of which that's what Maine has. So for the child, the pediatric dental benefit, again, this doesn't apply to, if they're in a family plan, it doesn't apply to the adults in the family plan, it just applies to the kid coverage. There is no annual plan maximum. Instead, there is now an out-of-pocket maximum. And that is, if you think of it, that's more the medical model. That, is what goes on in medical plans now typically. So what that means, just as in the medical model, once that child has satisfied the out-of-pocket maximum, then all of the coverage, whether it was 80% coverage to begin with or 50%, whatever the coinsurance of it was, after they've satisfied that out-of-pocket maximum, their coverage then flips over to 100% coverage. So after they've paid, for argument's sake, we'll say $700, if that's the out-of-pocket maximum, after they have paid that, then they're going to have 100% coverage paid for by the carrier. And again, that's Delta, that's, Anthem, whoever is providing the dental coverage. So that's a real switch, obviously. Another one of the requirements is that there can be no deductible applied to preventive services. That is straight out of the Affordable Care Act. But here's a twist that, that's what the words say, but then when you dig into the regulations a bit, you realize it has a different impact on dental than it does on medical. And this is why. In the Affordable Care Act, it has this very clearly no deductible applied to preventive services. And that's why, Adam was saying earlier, mammograms, other annual exams, that sort of stuff that's part of preventive medicine. But the agency that's responsible for identifying what those preventive services are, which is the United States Prevention Services Task Force, that agency's list of preventive services that must be covered at 100% does not include any services offered or provided by dentists. So that means that until they change those rules, technically, carriers that are providing services, the essential health benefit, pediatric dental benefit, can actually apply a deductible to preventive services. It's not even like a legal loophole. It's just, there you go. It's big enough to drive a truck through. Now, that's a policy decision that Delta Dental has made, is that we will continue to cover preventive at 100%. We're not, taking advantage of that provision because it goes along with our mission, and we get it, right, as you do, that prevention is where it's at. So we want to cover it. We want to encourage those good oral behaviors. So another requirement is that any out-of-network expenses do not count towards the out-of-pocket maximum that I was just talking about. So someone has to stay within network to count towards that services. And just as the medical plans have actuarial values, the meta levels that Adam was talking about, as in part as a way for consumers to have an easier time of comparing plans to other plans, having some straight line that they can make a comparison. Dental doesn't have the 4 meta levels. Instead, there are 2 levels, a 70% and an 85% actuarial value. We refer to it as the 70% is the low value, the 85% is the high value. Again, this is not a Delta dental rule. This is across the board for any pediatric dental benefits. So what that means is, if you look at what a typical person's usage and claims would be for the year, the plan will pay, on average, 70% of what that plan, of what those claims would be expected to be. And 85% is the higher value of the plan. The other part is that for all the pediatric dental benefits, medically necessary orthodontia must be covered. So that's another key difference too. And again, so this is whether these plans are sold on or off the marketplace. If they are required to carry, if it's the pediatric dental benefit, then all of these provisions apply to that, all these requirements. Adult coverage is not impacted by the Affordable Care Act. All this stuff that we were just talking about does not apply to the adult coverage. So adult coverage should look essentially similar to what you see in your offices now. There won't be any changes to that. Those plans will still have, a plan maximum. They won't have an out-of-pocket maximum. All the usual stuff that you would see now won't change. You'll just see changes, again, just driven by the pediatric. And again, only for the kids who have the pediatric dental benefit, not just regular kid coverage, dental kid coverage. So what that means is, because these rules apply just to the kid coverage, the pediatric dental benefit part of it, within a family plan, as I mentioned before, there can be different cost sharing and different rules that apply, even though it's one family plan. So I think of it as, here's the family plan, then underneath that you've got what the kid coverage looks like, and then you have what the adult coverage looks like. Okay, so it's going to be, a little adjustment period to get used to what that's going to look like in practice. So I'm going to talk about what Delta Dental's plans look like on the main health insurance marketplace. So we are offering 4 plans, and this is the same thing that's being offered in the, let me back up and explain. So you know that the health insurance marketplace, there are actually 2 different marketplaces. There's for individuals who want to shop for health coverage, and then there's a different marketplace, different name, the shop marketplace, which is the Small Business Health Options Program. That's for the small businesses. In theory, they're 2 separate exchanges, and there are different rules that apply to them. But here in a state where we have the federally facilitated marketplace, it's still just one website that you go to. And if you once you identify if you're purchasing as an individual or if you're purchasing as a small employer, that it sends you 2 different routes. But it's the same website essentially, and it's healthcare.gov in case people have missed it or not read any newspapers for the last 4 months, right? Okay, so we have a pediatric-only plan. This was a requirement of the Affordable Care Act. So for people who are just going to buy coverage for their kids, they can have either a pediatric plan that covers just the kid or kids at the high level or the low level. And then similarly, we're offering family plans at the high level or the low level. And the family plan has to have at least 1 adult in it. That's how you would be able to distinguish between them. It could be more, it could be more adults than that. It could have the adult kids on the plan also, adult kids in the family. But there has to be at least 1 adult family member in the plan. That distinguishes it from the kid, the pediatric only plan. Okay, so here is what the pediatric plan looks like, Delta's pediatric plan that we're offering. Again, it's up to age 19. The high plan has the 180, 50, 50 coverage. Again, that the second 50 is that medically necessary orthodontia is covered at 50%. And then the low value plan is 160, 50-50 coverage. There's an office visit copay. For the high level plan, it's only $15. For the lower level plan, it's $30. Same thing with the deductible. For the high level plan, it's a $50 deductible. For the low level plan, it's $150. There is no deductible on any preventive services, as I mentioned before. The out-of-pocket maximum is $700 per child. But for families that have 2 or more kids in it on that plan, there's a family maximum of $1,400. So once the family has hit the $1,400 mark, all of the kids would then kick over to the 100% coverage for their covered dental services. If one kid hits the $700, that kid's coverage kicks over to the 100%, and then once the family has expended up to the 14 for the other children in the family, that's when everybody else would kick over. Okay. And that's when it switches to 100% coverage in all 4 categories. Diagnostic and preventive, basic, major, and if they've qualified for the medically necessary orthodontia, that orthodontia would be covered at 100% also once the kid has hit the out-of-pocket maximum, which is quite a change, right? And there is only the covered services apply to the out-of-pocket maximum. So if someone goes and has additional services done, that's not going to count towards the out-of-pocket maximum if it wasn't a covered service in the first place. There is a 24-month waiting period for the medically necessary orthodontia, and this is what the adult coverage looks like. So it's the same 180/50 coverage for the high plan, 160/50 coverage for the low plan. Obviously, since the orthodontia is not covered for adults, there isn't the fourth category there. The office visit copay is the 15 or the 30. The deductible is the 50 or the 150. So when they're coming into your front desk, the kid and the adult will have the same coverage levels, the same coinsurance, the same deductible, and all of that. Where the differences come up are with the no orthodontics covered for the adult. There is a plan annual maximum for the adult of $1,000 on our plans, but no out-of-pocket maximum applies to the adult coverage, as I talked about before. And then, fairly typical, our waiting periods are 3 months for the basic restorative and 6 months for the major restorative. The network that's involved, we're using the Delta Dental PPO network, which is particularly helpful if you think about, the families who have their grown kids or their kids who are college age on their family plan, because those kids can utilize the Delta PPO network wherever the kids are actually during the school year. The premier dentists are reimbursed at the PPO rate, similar to how we do things now, and the premier dentist can balance bill up to their filed fees. That's not new. Dentists who are outside of our network are going to be reimbursed at the allowance for non-participating dentists, and they can balance bill. Again, not new. But this is the part that is different, is only the cost for such services that are performed by the PPO dentists in the PPO network will count towards that out-of-pocket maximum. So that's something that consumers need to be aware of. So the next slide is, because this is a lot of information we've given you, this is not part of your handout, but we're totally fine making this, the presentation itself, available if you wanted to put it on your website. I assume patients sometimes ask you, what kind of coverage should I be looking at? Or what is, if they're talking to you about this, these are essentially some of the considerations that people who are subscribers who are thinking about what kind of dental coverage do I want, because again, there's some different choices for people now. Some of these considerations are what people have always looked at: is the dentist I want to see, is my dentist in the network? Do I have to go outside of this network and see somebody else, or what do I have to do to get a plan that covers the dentist I want to stay with? So that's the network. The first question, obviously, though, is whether or not they're required to purchase it, because as I explained in the beginning, there are whole categories of people who do not have to buy this pediatric dental benefit, which leaves them open to continue getting the more traditional dental coverage, whether it's through a standalone or whatever their preference is. One distinction also is the issue of, because carriers vary on this, whether or not they're applying a deductible to the dental preventive or not. I had mentioned that we're not. I don't know if that's the same across the board. You'd have to look at the different options to see from different carriers if they are or not. There's nothing in the law that says, again, that those preventive services have to be covered at 100%, right, if it doesn't apply to the dental. So that's another plan variation that people may see. Also, while I don't think it's much of an issue here in Maine, I do believe that there are some medical plans being offered on the Maine exchange that did go the route of embedding the dental benefit. That's the minority of medical plans that are being offered on the exchange. But something that people really need to look at there is that if the dental benefit is embedded in the medical plan, there is no separate standalone dental out-of-pocket of $700. The out-of-pocket maximum that applies and the deductible that applies is the medical one. So as you know, a medical deductible can be a couple $1,000s. A medical out-of-pocket maximum for this year alone can go up to $6,350 per person. So that's one of the other consumer considerations to think about too, is if you're getting the embedded plan, you may not actually see any real dollars covering your dental until you've satisfied the medical. So unless you have high medical expense, that dental benefit may not really give much to you. Those are people who may want to get additional dental coverage. That is the website that folks can have access to find out of individual and family plans, and small group for that matter.